The human body is one of the world's greatest wonders. Electrical impulses race through the brain at the unimaginable speed of 350 kilometers per hour. A network consisting of 1 trillion nerve cells processes an endless amount of information. Over the course of a lifetime, the heart beats more than an incredible 3 billion times. In just a single day, it pumps over 14,000 liters of blood through a dense network of veins, arteries, and capillaries, amounting to a gigantic length of over 90,000 kilometers. 2 million microfiltration units in the kidneys filter more than 1,700 liters of blood every day to remove substances that are toxic to the body. Sheerly amazing superlative feats that the human body accomplishes day after day. Accomplishments that go unnoticed until one of its organs fails. The aim of dialysis, in particular, is to imitate the body's incredible performance as perfectly as possible, and accomplish in 3 times 4 hours what healthy kidneys have 7 days a week, 24 hours a day to do. With its new Diacap Alpha Polysulfone Dialyzer series, Braun now supplies the full range of all dialysis components. Starting with the Dialog Plus dialysis unit, blood tubing systems and solutions, up to the actual core of extracorporeal circulation, the dialyzer. As early as during the development stage, Braun places great emphasis on quality, perfect functionality, and stability. At the core of the Braun Diacap Alpha Polysulfone is its membrane, produced with the highest quality standards at a specially constructed production plant. Dialyzer performance has been considerably enhanced by the innovative undulation of the hollow fibers. The dialyzer and fibers are also assembled in Braun's own ultra-modern production facilities. All components, such as dialyzer housings and hollow fiber bundles, are automatically conveyed to special workstations for assembly. Every dialyzer is labeled with its own identification number, ensuring 100% traceability during each production step. High-end processes based on years of experience in developing production plants, like the use of new laser technology, significantly enhance dialyzer performance and biocompatibility, an effect that has also been confirmed by scientific evidence. Each of the over 20 production steps is performed under cleanroom conditions and has been validated according to international standards and Braun's own high internal quality criteria. The highly advanced processes used for production of Diacap Alpha Polysulfone dialyzers have yielded marked improvements, from fiber bundle potting and pre-cutting to final cutting. Control stations automatically identify and reject any defective dialyzers. Special process expertise, ultra-modern microwave technology, along with comprehensive quality management, guarantee consistently high-quality products. Dialysis therapy certainly demands the ultimate in dialyzer performance. By sharing expertise through constant interaction with physicians, Braun has developed low and high flux dialyzers that satisfy the highest requirements. Diacap Alpha Polysulfone dialyzers give both physician and patient a good feeling, knowing they can trust in an outstanding product proven in clinical routine.
For the last 2 years in our dialysis centers, we were using only polysulfone type dialyzers, including the Diacap Alpha Polysulfone dialyzer family, and we are very satisfied with this product. We found that the Diacap Alpha Polysulfone has a very good biocompatibility profile. We also saw that compared to other polysulfone dialyzers, we saw much fewer episodes of hypersensitivity reactions. Looking at the quality indicators, we found that patients who were switched to the Diacap alpha polysulfone showed slight improvement in some of the quality indicators like hematocrit and KT/V.
Hier auf der Kinderdialyse haben wir langjährige Erfahrungen mit den Diacap Alpha.
We have, especially with children's dialysis, years of experience with Diacap alpha polysulfone dialyzers. The Diacap filters produce convincing results thanks to high biocompatibility with low complement activation. Especially with children, it is important to keep extracorporeal blood volume at a minimum. Diacap polysulfone dialyzers are ideally suited for use with children. The positive residual blood behavior does not additionally burden the chronically anemic child by causing blood loss.
In addition to the good tolerance of the dialyzer, its handling is very important to us, especially the filling and rinsing of the blood, and dialysis fluid site must be affected very carefully. The fibers of these Diacap dialyzers are specially textured, which facilitates careful and fast execution of these procedures. These dialyzers are fast and easy to handle both in the preparation of dialysis and in the post-dialysis procedures.
Dialysis therapy requires the best possible performance from dialysis. Fully synthetic alpha polysulfone dialyzers used by us give me and my patients the feeling of being able to rely on an excellently tried and tested material used in everyday clinical practice. Of those parameters used to establish the biocompatibility profile of a membrane, we investigate particularly the complement activation and the generation of anaphylatoxin C3A and C5A. There are considerable differences between the membranes, which all come out to the advantage of alpha polysulfone membrane. Especially the efficient elimination of middle molecular toxins during high-flux dialysis with HIPS dialyzers has a positive effect on the typical clinical problems arising with dialysis patients.
With its new Diacap alpha polysulfone dialyzers, Braun proves that sharing expertise guarantees products that can replace the body's incredible performance in the best possible way. Braun has made this its standard